Well, as always, a very good afternoon to you or good morning, wherever you are listening to our webinar today, either live or on your favorite streaming service. My name is Natalie Ashdown from the Open Door Coaching Group, and welcome to our conversation today around World Mental Health Day, which was just this week, and overcoming the barriers to mental health conversations in the workplace. And today I'm joined by former Group Captain of the Air Force, Andrew Figtree. Welcome, Andrew.
Thanks, Nat. Really great to be here, and thanks for the invitation. Happy World Health Day for Tuesday, and it's also World Mental Health Month, so it's great.
Yeah, thank you so much for joining us. We're really looking forward to you sharing your experience with us today in your capacity as obviously a former senior leader of Air Force, but also as a mental health first aid practitioner and trainer. And of course, your broad experience working across Veterans Affairs, etc. So thanks, Andrew. And if you don't mind, I'll call you Figgy because that's the way I know you as well.
That's fine. Figgy's great.
Thank you. So just before we begin, we acknowledge the traditional owners, the custodians on the lands on which we're all meeting today, and their continuing connection to the land, the waters, the communities of Australia, and the lands from all around the world, wherever you might be joining us today. We pay our respects to them and to their elders past, present and emerging, and elders from Indigenous communities from around the world. So just a quick show of the agenda here, because I really am keen to get into our conversation and spend as much time learning from Figgy as possible. But we really want to draw our attention today to World Mental Health Day and Mental Health Month, as Figgy mentioned. And today we're talking about overcoming the barriers to conversations that we might see in the workplace. This is based on our experience, a lot of what people have told us that might get in the way of having mental health conversations. And particularly, Figgy and I have been discussing the really important link. So there's a lot of alumni on the line who are qualified in coaching, and the link from coaching through to mental health conversations. I think there's a lot we can talk about there. If you are new to the Coaching Cafe, welcome. I say this every week, but we are all about creating a community, sharing our learned experiences and having thought-provoking conversations. And there is ICF CCEs available at the end of the session if you're listening to this live. And as you know, to all the regulars that come back every Friday, you know that we love Fridays, you know that we love spending our time with you at this time. So thank you for coming back and sharing. And if you'd like to interact with us, please feel free to pop a message into the chat box and I'll pick up your comments and any questions you might have in that way. So as I mentioned, we will be discussing mental health in the workplace today. So just before I begin, I just want to let you know that we acknowledge that you or someone you know might have a lived experience with mental health. Some participants might find when we're talking about mental health conversations, they might find it confronting or distressing. So if you or someone you know needs support, we really encourage you to contact the organisations or the numbers and the websites that are on the line: Lifeline, Beyond Blue, Suicide Callback Service, and if a life is in danger, of course, call 000 as well. So just letting you know that we acknowledge that people do have lived experiences as well. So Figgy, I want to throw it over to you. We've been talking a lot about the lived experience, not lived experience. We've been talking about the barriers that people might be thinking about or coming across when they're wanting to have mental health conversations in the workplace. And I've put up a slide there, and there's a lot actually when we brainstormed it. Everything from being told that you need to do mental health training through to I'm worried about people's reactions. I don't know what to say. There's this kind of stigma. I feel uncomfortable.
Yeah.
I can't pick the right place and time. Even getting buy-in from management. The perception that it's not my role. You know, those barriers. There's quite a lot. So I wanted to firstly ask you about some context, just putting our conversation into context and thinking about, there's many coaches on the line, Figgy, and how do you see the link between coaching and mental health conversations in the workplace to kick off our conversation here?
Yeah, sure. Look, I believe that a lot of the skills we have as coaches are really, really appropriate to having mental health conversations. We can use the skills such as active listening, as asking open questions, and also repeating back or paraphrasing and saying, so this is what you're feeling at the moment. That must be really hard. And that makes sure that the person we're talking to knows that we're listening. It knows that we care, and that we're engaged with what's actually happening in their space at that time, because it's very real to them. And I guess that's one of the things you've got there, not being able to see the injury. And I think that's one of the critical things, and why we need to have such things as World Mental Health Day and World Mental Health Month, is that if someone comes into work on crutches and you go, crikeys, what happens? And they say, oh, fell down the stairs, or I fell off my bike, or whatever it is. We go, oh man, that sucks. Like, or a certain person who might be in a sling at the moment. That's terrible. So we're immediately empathetic and compassionate, and we'll talk to them about that sort of an injury. But just because you can't see the injury doesn't mean it's not a real injury. So I really look forward, as both a mental health first aider and a mental health first aid instructor, to a day when we just see physical injury and mental health injuries as being the same. They are completely the same. It doesn't mean that the person's not suffering. It doesn't mean it's not real to them. And it will impact their ability to function, to have good relationships, to live a fulfilling life. I think it's a really interesting point, Nat, that in the next year, people aged between 18 and 65, 20% of those people will experience a diagnosable mental illness. So if you think about the number of people online today, I haven't seen the numbers. Oh, there's 20 of us. So four right there. At least four of us are going to experience something like that. And I think that's a really sobering kind of a thought, that it is that prevalent in the workplace. I think, sorry, just coming back to your question about coaching, something that we really learn as coaches is we want to empower our managers to talk to their workers, talk to their middle level managers, and talk to them and empower them to come with solutions. Give them the confidence that they actually have the solutions in themselves. It's just that they need to work through it and bring it out. And it's kind of the same in the sense of where I came to from mental health first aid. So we were deep in the pandemic, and I saw a lot of my commanding officers, so my middle level managers. So I had about 200 people that I was responsible for directly. A lot of their time, like sometimes up to 90% of their time, was spent dealing with people who had slipped through the cracks and were experiencing a mental illness. So what we did there is we rolled out the program, and this is about education and normalising the conversation. And we gave them the tools, and then we started from the top down, but we also then started after that, or actually along that path, we started from the bottom up as well. So the people on the floor, the worker bees, were able to actually get that training and get those skills. Now, not everyone, it's not the training that everyone wants or needs, but it's always good to have a bit of knowledge of the resources that are out there. And a couple of ones you put up there, particularly Beyond Blue, has some really excellent resources on their website. Sorry, I went a little bit across a few topics there, but
no, there's so much that you've actually shared, and I was just conscious of the laugh that somebody might have heard, that you would have heard me on our webinar today, and Figgy referencing, an arm in a sling, and here you go. I can totally relate, because I'm here with you all with a fully fractured elbow from a bike accident, and I can definitely relate to what you're saying, Figgy, that so many people have reached out, seeing my physical accident, not seeing the accident, but seeing the result, the arm in a sling, etc. And it's been really lovely for people to reach out and ask me about my injury and how I'm going and how I'm recovering. It has not escaped me for a second, actually, that that we do that with physical injuries, but less so with potentially mental health conversations. I think having a physical injury has really highlighted what you said there, Figgy. And what's also highlighted to me as well is when we're having these conversations, our role as coaches, but also as our role as people, authentic human beings, to be able to listen and, as you say, paraphrase, create that space, be there. So those characteristics that we know as coaches, need to come across, not just in a physical sense, but also when someone might be suffering and needing a mental health conversation as well.
Yeah, look, I think you touched on a really important point about just being a human being. And I think that's really important when it comes down to thinking, oh, it's not my role. Like that's the boss's role, or that's the lead of the project's role. I think like it's kind of our brains trying to protect us a little bit because we feel uncomfortable in that space. As Brené Brown would say, vulnerability is the key to connection, and that's what that person who's suffering the mental health crisis is or challenge is after some connection. And I think it's also good to normalize it in the sense of what would I want if it was me that was suffering? What would I want if it was my partner or my best mate? I'd want someone to actually go, hey, how you traveling? Like this is, you seem a bit down, or what's going on with you? How have you been the last week or so? And I think some of those things, they're coaching questions in the sense of trying to crystallize a time frame and what's going on with you. And you might also give that, I've noticed you're coming into work late. I notice you're here all the time. It might be presenteeism, it might be absenteeism. It might be, they're just not engaging. They're not getting engaged in work meetings or work activities. They're not getting even just sort of sitting at their desk, eating their lunch and not doing it. So it's out of the norm. So some of those signs might be overt. They might be some things that we notice, but they're the sorts of things that we do. But unfortunately, if you don't actually just contain it and you do that, are you okay? Which I think Are You Okay Day is great, but it's a great slogan. It's not necessarily a great question, because what we tend to do as humans is we go, yeah, no, I'm fine. Yeah, ticking along. Yep, all good, not a problem. Whereas if you actually cage a time frame and also give that compassionate bit, I've noticed you just sort of seem to be a bit disengaged with everybody. Then I think that shows that you're caring, you're noticing, and that can be what will actually entice someone into the conversation. And that's when we become that part coach, but just a human being. So I think that's really important to move away from the human doing and be the human being.
Yeah, absolutely. And thank you. You're pointing out some of the signs and symptoms that we might notice in the workplace, where it might be that we need to make that connection and perhaps open up a mental health conversation, and things like something is not normal, so that the person might normally be engaging, or they might normally be present or eating lunch with people. They might normally be whatever it might be, and that they've deviated from that, I suppose, over a period of time. Yeah. So thank you for pointing those signs and symptoms out.
Mm-hmm.
And you have started touching on some of the barriers that we've listed here, including not knowing what to say. So thank you for sharing that, Figgy. What other of these barriers would you like to really highlight to us, and what, given your background in training and being a trainer in mental health first aid, there's some of the ideas that you might have for people who are listening to address some of those barriers?
So I guess there's a couple of parts to that question, Nat. Like the first part, I guess, is the stigma that is generally in the wider community associated with coming out and saying, hey, look, I'm suffering a mental illness. And people are like, oh, okay, that's no good. So they tend to be a lot more standoffish. And I think what we can do by educating ourselves a bit and getting a bit of training, it doesn't have to be that full-on couple of days course. It could just be a bit of Googling and looking at websites. But a bit of understanding actually normalizes it a little bit more. And the more we're comfortable with talking about mental illness and mental health challenges, then the better off we're going to be to actually help somebody. So normalizing it's important. As I said before, 1 in 5 people are going to suffer a mental illness or a diagnosable mental illness over the next year. And really concerning also is that only 47% of those people are actually going to go and seek professional help. So what we know from the statistics from psychologists and psychiatrists and general practitioners is that the sooner you seek help, the more successful and the shorter the time frame to actually achieving well-being will be. So I think that's really important. Take on some of the things that we would use as a coach, as I said that before, about open questions. Use caring words. So is it okay to ask how you're going? So be considerate, respect their space. A great question, if you think, the conversation's starting to open up, it's and it might not be that they're ready for that, but have you thought about talking to your GP? GPs are a fantastic resource of having those conversations. They're brilliantly trained. They're well resourced to point you in the right direction and to get you professional help if they're not able to provide it. And I think, and what I've been talking about the whole time is that we express genuine concern and empathy. So we actually make sure that the person understands that we care about them. So that noticing that something's not quite right, the paraphrasing, reading back the the little phrases of that must be really tough, or that must be hard, or thank you for sharing that. That must be, that's really bold of you and or brave of you. Well done. So those support words, those empathetic words, I think are really important. And I think one of the other things about education is that we can use the right terms, and I think that's important as well. There's been over a period of time where I think we're getting better educated as a society to use terms that are more appropriate. But, there's still terms that have probably got some judgmental kind of connotations on them. So, if you don't know, then just don't label it. And just like physical first aid, where if we come across a person who's fallen over the gutter and then you're just expected to do the best you possibly can at the time. You're not expected to diagnose that they've got they've broken the left femur and they've got a hematoma on the body, the back of their skull. You're just there to do the first aid. And it's the same thing for mental health first aid, or to have that mental health conversation. It's like you do your best at the time. So I think that's something good to take away and can give us some confidence.
So many things that you've touched on there, Figgy. Like, really, I hope that people are listening might take the opportunity to listen again to your words. I'm needing to take notes, even for myself. And there's a couple of things you touched on. One thing was around the GP. That was something that when I did my training, I was wondering about, are GPs actually trained? So I did some research, and the answer is yes. And also that there might not be just one alternative or one GP or one solution. There's a broad range of ways that people might be able to seek support, including different GPs if they're not quite the right one. And then the other one that really stood out for me too is that we can just do our best. Like, I think sometimes there's a barrier around trying to get the right words, pick the exact place, the right timing. There's privacy. Like we try to perhaps, think about all those things, whereas, it doesn't have to be perfect. But you did have some ideas around, that place, the right, perhaps some ideas around privacy, the right timing, that kind of thing as well, though.
Yeah, sure. Look, I think that's really, really important. You don't bust open this conversation in the middle of the tea room, sort of thing. So, I think it's someone's hurting and they're being brave in actually opening up. So, it might be that the conversation, you're just both there getting a brew, and you say to somebody, how are you traveling? Like, how's the last week been? You seem a little bit down. And then they might start to open up. Someone else comes in the tea room and goes, hey, would you like to have a chat a little bit later? I can organise a meeting room. So it's got to be private and it's got to be confidential. The only time that we would ever bust that confidentiality, and we would tell the person, is if they're expressing suicidal ideation, or they say that they've actually got a plan around suicide. And that's when we say, look, I can't keep this confidential for your safety. So the first thing that we're doing is we ask them directly, if suicide is entering that conversation, we ask them, are you thinking about suicide? Are you thinking about killing yourself? So be very direct in that one. And it's a hard question to ask, particularly if it's someone close to you. But it's really important, because that does the same thing as before. It lets them know that we care, we've noticed it. We then keep them safe and we connect them with professionals. So that's the only time we'd ever bust it. Something that I've used both as a coach and as a mental health first aider is actually suggesting we go for a walk. Walks are really good, non-confrontational kind of we're out and about, we're just having a walk, and it relaxes us. If they want to have, shed a few tears, that's okay too. And I don't think that's something that we should ever be afraid of as around the mental health conversation. If we're worried about them getting emotional or crying, then I think we just got to be that human being again. We've got to reassure them, it's okay. This is hard. I get it. Just let it out. It's okay. So yeah, touchy-feely, don't like that. But again, I go back to what would I want if this was me? What would I want if this was my partner, my wife, or what would I want if this was my best mate? I'd want someone to look after them, to put their arm around them and go, hey, I'm here to help. I can't diagnose you, but I can help you, and be a listening ear. So I think that's really important. And I think it also then sort of can go into the area of what happens if they don't want to talk? What happens if they if they go, no, I'm fine, it's okay, no, that's okay too. There's no such thing, I don't think, really, as a bad mental health conversation, or if you open up that human connection piece and you just say, hey, how are you traveling recently? You just don't seem to be quite yourself and I'm worried about you. If they go, no, I'm fine, that's okay too, because you've let them know you care, you've let them know you noticed. And what I'd really say is check back. Give it a couple of days, maybe it's next week. How you doing? How was your weekend? What did you get up to? You've opened the door a little bit, and that might just be enough for them to percolate through their sort of their subconscious and their thinking to a point where they go, hey, you know how you said last week that I'm not traveling so well and you were worried about me? And you go, yep. Could we have a chat? And you go, that's fantastic. So, and that's happened to me as well. Like it's it might be a week later. So yeah, check back. Don't pester them. You got to respect them, and you might not be the right person always to have that conversation. There are gender barriers, there are race barriers, or ethnicity kind of barriers. So you need to be sensitive to that as well. But like you've done your best. And I think that's what you've got to be satisfied. So it's one of those things where the whole way through this, choose discomfort over resentment. Because if I didn't have that conversation and something terrible happened, or that person ended up getting a whole lot sicker, I would resent the fact that I hadn't tried a little bit harder, or that I hadn't checked back. So yeah, just be a little bit happy in that discomfort area sometimes, I think. I did sort of talk very quickly there about what if I get it wrong. I don't think there's such a thing as getting it wrong, and I'd really encourage people to try and get some education around this. Lots of resources. You don't have to go far. You don't necessarily have to pay up for a mental health first aid course, but it is an excellent course, and it will really empower people to normalize the conversation, to feel a little bit more confident about actually asking. And just like in coaching and the coaching culture side of the house, where we want to roll out mental health programs and wellbeing programs, you need that senior buy-off. So I think that's an important one as well. So yeah.
Yeah, again, there's so much in what you're saying there, Figgy, and I'd add to everything you're saying that sometimes I've even used the words along with, I'm not sure if this is if I'm saying the right thing. I'm not sure how to ask this question, but I'm worried about you, and I'm wondering if, or I'm
Yeah, yeah,
wondering, so I think sometimes actually, I remember as coaches, and I encourage coaches to say, I'm not sure what the right question is here, but I'm wondering. And I
yep,
think that actually shows that we can be vulnerable and not perfect as well, that we don't exactly know what to say, but we want to actually open up a conversation. I wonder if we could open up a conversation about what I'm seeing or how you're feeling, et cetera,
yep,
et
yep,
cetera.
yep, yep.
So
Yeah, definitely.
yeah, that's really nice as well. And you've touched on, the so many of our barriers that we've listed,
Hmm.
including picking the right place and time, or just that privacy. You also mentioned about the boss's buy-in as well. So if we
Yep.
are thinking about how do we make this more normalized in the workplace, you have talked to me about, we need to get the right people involved as well.
Yeah,
It
look,
also, I think, relates to that fact where people say, the other barrier we find, figure, where people say, well, you know what, it's not really my role. In the
yeah,
corporate organizations, people say, well, that's HR's role, or that's someone else's role. And, in the military or hierarchical structures, it's like, well, that's not my role, that's the boss's role, or the
mm,
padre's
mm,
role, or psychologist's role.
mm.
So just wondering what you thought about that as well.
So I think that just comes back to what I was talking about a little bit earlier, that I think it's everybody's role. We're all
Yeah.
human beings, and I think we
Mm.
need to. It's that's sort of like a something we're hiding behind. That's not my role. I don't want to be the one to have that conversation. That's the boss. But again, go back to that. How would I like to be treated? How would I like my wife to be treated? How do I like my best mate to be treated? I would, as I said
Mm.
before, I'd like someone, and it not necessarily the boss, but the person that's noticed, to say, hey, how you traveling? You don't seem so well. So I think it's everybody's role, to tell you the truth, and that's just part of being a human being and living in our world. So I think that's important. I think one of the other things to also, well, couple of things. I'm sort of having a bit of a squeeze at the time there. We're coming up to it, but
That's okay.
there, if people are interested, go to the Mental Health First Aid Australia website, and in their resources somewhere, they will have how they see rolling out workplace programs. And there's quite a number of corporate organisations, banks. I can't think of them off the top of my head, but there are quite a number of corporate organisations that have rolled out mental health first aid programs where there's top level buy-in, and then they're empowering people all the way down through the chain. And it's not just HR. And I think that's really important, that it's not just HR, because HR isn't out there on the floor, and this is about actually noticing that your colleague's not doing so well, and reaching out and trying to help them. Or at least offering them some help. So I think that's important. The other thing I wanted to say is that sometimes these conversations are really hard. So be kind to yourself afterwards, and think
Yeah.
about a bit of self-care. Go do something, or that night, do something that you might not normally do, but it's a bit of a treat. And tell somebody if it's a really hard conversation. I think particularly if they're conversations around suicide, or serious mental illness, I think they can be really draining conversations, and it helps to actually talk to someone and just say, not releasing all the details or who it is, to say, oh, look, I had this really tough conversation. I'm glad I did it, but yeah, it helps to have that little bit of sharing. So and yeah, self-care is important when it comes to mental health conversations.
Yeah, thank you, Figgy. There's again so much that you've offered there, and I think it's a great way to actually conclude our conversation. I can't believe it's gone so
It was
quickly
quick, wasn't
because
it? Yeah.
you've got so much to share with us. Thank you. But yeah, it is really important to look after ourselves as well, and
Definitely.
ourselves to reach out if we need support. So we think about the person we're trying to support, but also how we actually look after ourselves in that process as well. And I
Mm,
do agree with you. It's not just one person's role. And I love what you say there. It's how would you like your mate or your other colleague or your
Mm.
mother or
Yeah,
whoever it
yeah,
might be?
yeah.
How
Yep.
would you like them to be treated if they were suffering? And as we've talked about, there's no perfect one way to actually have a
No.
conversation, and there's lots of resources available, as you mentioned. So, look, I think in our conversation, you've touched on all the barriers we've talked about, given us some
Mm.
really practical ways
Yep.
of approaching those conversations. And as you said, it gets down to that genuine connection, the coaching skills that we know of, the listening,
Yep.
the just creating that space where someone can open up to you as well.
Yep. Yep. Definitely. Two ears and one mouth.
Yeah, exactly. Yeah. Well, I want to thank everyone for being part of it. Again, Vicky has mentioned we do need to look after some ourselves. So I just mentioned again, if you or someone you know needs support, that you can call upon Lifeline or Beyond Blue or the suicide callback service. If someone's life is in danger, we would call 000 here in Australia for those people that are listening. And what I would like to also point out is that Wikipedia, we can go to Wikipedia, you can actually, if you Google search, you can find all of the international support services and networks available as well. So we've been having conversations internationally around mental health. Interestingly, in our region, the Australian statistics that you're talking about there, Figgy, 1 in 5 people might face a mental health problem.
Yeah.
Those statistics are pretty consistent
Mm.
actually in
Mm.
our Asia Pacific region. Even some of our neighbouring countries, though, it's actually higher. So there's a lot of opportunity if you're listening internationally as well. You can find the local resources very, very quickly. By doing a Google search and looking at your own government's websites as well, where those support services are available. So, Figgy, on behalf of alumni, I'd just like to thank you for your insights that you've shared so much. We
Thanks.
do mental health first aid training, and Figgy does mental health first aid training as well, rolling it out to different corporates. So, just letting you know, we do have those programs coming up. Diplomas coming up, so is Cert 4, and so is Leader as Coach. So, if those programs are interesting to you, of course, you could always reach out to us. So, Figgy, once again, on behalf of the alumni, thank you for sharing your wisdom. We really do appreciate it. And thank you for the work you're doing in this area of mental health first aid as well.
Thanks, Nat. Thanks for the opportunity. Great to be here.
So we'll just